Good evening. An intensive care doctor has been speaking out about the struggles facing the NHS and says Brexit has made a bad situation even worse.
Her comments came on the day Theresa May outlined her latest plans for leaving the European Union. Dr Samantha Batt-Rawdon, who works at a hospital in Surrey, says highly skilled EU staff are leaving or have already left because of the uncertainty.
Latest studies suggest that 1 in 3 intensive care units are understaffed and hospitals have to transfer some patients elsewhere.
The government, though, says it's ploughing billions into NHS trusts and is encouraging all staff, EU workers included, to stay within the NHS. Stacey Poole has our exclusive report.
I think that big red bus with the 350 million, was it, on the side, I think that was utterly irresponsible.
Brexit promised so much. £350 million extra for the NHS. And this was the reason many people voted to leave.
They genuinely thought that they were doing a good thing for the NHS. They thought that leaving the EU was going to mean more money for the NHS. And now what we're seeing is that is just not true.
Dr Samantha Batt-Rawdon works in intensive care, witnessing firsthand every day the reality of Brexit.
Our nursing staff, our highly specialised EU colleagues, are leaving and in fact have already left. And this means if you're a patient and you become critically unwell, there may be a physical bed for you, the machines are all there for you, but there's no nurse to look after you, and that means we cannot admit you to the intensive care unit and you do not get the care that you need.
So you've actually seen critical care beds close because you don't have the staff?
Yes, I am seeing that happen, and it's awful because as a doctor you want the best for your critically unwell patient.
And her concerns are echoed by the British Medical Association.
We just won't have the numbers of staff, doctors, nurses and other healthcare professionals in the UK to serve the needs of the population. We know that about a third of doctors who are from EU nations, that's about 10% of the workforce, are saying that they're likely to leave the UK in the event of Brexit. That comes at a time when we have 100,000 job vacancies in the NHS. We have an NHS that can ill afford to lose a single doctor, let alone several thousand.
The clinicians that we spoke to fear an NHS which is already struggling is going to find things even tougher after Brexit. And as a mother of a child with cerebral palsy, Sammy's concerns are not just for her patients, but also her son.
My son spent 3 months in intensive care. He has cerebral palsy. He has been so well looked after by the amazing institution that is our NHS. But even now, we are starting to see cracks appearing in his care. And that's nothing to do with the dedicated clinicians who saved his life that are continuing to support him with his cerebral palsy. It's just that we do not have enough doctors. We do not have enough paediatricians, physios, nurses. So as a mother, I'm really concerned for my child. As a doctor, I'm really concerned for my patients.
Even the NHS Confederation, whose role it is to analyse and try and minimise the impact of Brexit, fear this transition is not going to be without pain.
We've had decades of collaboration on medicines, devices, public health, research, treating rare diseases, and to stop all of that at once, it's not really possible to manage for all the various risks that could happen as a result of that.
There's a bit of an air of panic. We don't know what sort of deal we're going to get, if any, and therefore people are having to prepare for multiple scenarios, many of which are going to be detrimental for the NHS. I mean, just last week, Matt Hancock, the Health Secretary, said that he could never guarantee that there wasn't going to be an impact on the NHS, and this is from the same person that's stockpiling body bags. I mean, Brexit's supposed to be about taking back control. I think we're totally out of control.
Stacey Poole, ITV News.
Well, let's cross live now to our political correspondent Phil Horn.